My name's Maree Todd, I'm MSP for the Highlands and Islands, and I'm also the Minister for Childcare and Early Years in the Scottish Government. Why is PACE important? Well, I've only been in the job for 10 days and already I have spoken to so many people who have emphasised just how crucial permanence is to these children. And I come from a healthcare background, so I was a specialist pharmacist in a mental health hospital. And there we use these improvement techniques to improve care, to improve clinical care. So the Scottish Patient Safety Programme we found incredibly effective and empowering, and I'm really delighted that that type of improvement technique is going to be used to improve the outcomes for these kids.
In terms of PACE, I think from my end of things, what I would suggest is the main driver is earlier intervention and preventative work in terms of ensuring that we have robust cases, robust decision making, and ultimately multi-agency decision making to reduce drift and delays for children. And the earlier we front load the work and the earlier that we manage to get that evidence, the better core outcomes we'll have at the very end of it and the better outcomes for the children overall.
Hi, my name is Brendan Cochrane. I'm the acting team manager for the Children and Young People Review team in the City of Edinburgh Council. For me, PACE is about the overall improvement of outcomes for children. I think it's an exciting opportunity for Edinburgh to work with and to embrace. I believe that Edinburgh currently has some good practices in place, but I think, like all local authorities, there's areas of improvement, and I think for us, through this programme, we'll be able to identify those areas, work closely with other professionals to ensure that those standards improve and the overall outcomes for children improve.
So my name's Sean Russell, I'm a reviewing officer and I work for Fife Council. I've been involved with PACE for about 10 months, something like that. And for me, PACE is really, it's a rights issue. It's about local authorities doing the absolute best thing they can do in terms of making the right decisions for children as soon as they possibly can. And the sooner they can bring those timescales down, the better it will be for children, because they can go home if they need to go home and there's no delay in that. And absolutely, for me, that's a rights issue. And they should have early decisions made about permanence. For me, I can see changes in Fife already, and that gives me hope that as we spread out the process, it'll have an effect for a lot of children.
I think for me, PACE is about relationships, it's about values, and it's about culture. Certainly in Renfrewshire, it's led to improvements in timescale for children going through the system. It's better decision making, but I think also it means that you've got a group of people working together for a common goal of making better decisions for children and young people. And it's built up relationships, it's built up a sense of respect among the various partners in PACE, and it's definitely helped our thinking overall. The relationships have spilled out into other areas beyond PACE, and they've helped the working of the Children's Panel, it's helped the working of everybody who's concerned with the safety and well-being of children in East Renfrewshire. We're doing things with social work, like joint training, where it wouldn't have happened if it hadn't been for PACE.
I'm Stuart Osborough, I'm a business analyst at City of Edinburgh Council. For PACE, for me, it's the intelligent use of data to support decision making around the outcomes for children and young people. It gives authorities a real chance to use improvement science in the work they're doing and embrace the data that's available. It allows me to support colleagues in understanding data and what data can bring to the table in terms of understanding the processes and the outcomes that we can get for young people, so that they can use that data in a meaningful way to support their decision making and understand the changes that they're making are actually making improvements to the processes supporting children and young people through the permanence process.